How dan sa tao kiwig ng tatamskaw no ako magantig magapmis na nihiwas kamgag hintay sini makakyog tatamskat now. Good morning to everyone. My name is Chief Jack Rain. I'm from the Big River First Nation. I would like to thank the elders this morning for their prayers. I would like to thank the chiefs, council members, dignitaries, distinguished guests, visitors, and members of the press. Kakyog tatamskat now. Big River First Nation has always welcomed innovation and technology, and today we are honored to represent as lead champions for the First Nations community portion for this project. TryCycle is a digital tool to increase Indigenous to Indigenous supports in First Nations communities for people who may be struggling in addiction, depression, or mental health. This innovative approach will introduce a first of its kind tethered approach to wellness and care. This program provides access to a free mobile app available in both English and Cree, supported by trusted community-led nurses and health team members who can reach out to offer support. Program participants receive regular reminders to check in the app and share information about how they are feeling and coping that day. This information helps to identify early warnings, signs, and risk before event crisis. Our Big River First Nation health team began this journey with TryCycle in 2020. With the app itself, it has evolved since. We are proud to say we are utilizing the app for our own community and health needs. It is an understatement to say that we are not only excited at the idea of ownership of our own health strategy and data sovereignty, but also for the results for change for a healthier community. We are also appreciative of this path and high priority of creation of an app from a First Nations approach, of which we received from TryCycle. For us, the meeting of the First Nations beliefs and modern technology for a new path in First Nations health is inspiring and full of hope to see that together we can build a way forward. I would like to acknowledge Big River First Nation health team for taking this project, even in the midst of dealing with COVID-19 pandemic. The care of our community is seen daily, so thank you very much. Of course, I would like to recognize our innovative partners, TryCycle, for the vision and care that is evident in the project that we are announcing today. We are grateful for the journey thus far and look forward to future initiatives. And finally, we acknowledge the Federated Sovereign Indigenous Nations for taking on reconciliation initiatives as this, where we, our own people, can help our own people with other peoples to take steps towards healing in a holistic manner and also according to treaty mandate. This project and partnership are a monumental step in the right direction towards a healthy future for our children and grandchildren, and we will continue to extend our commitment to work with those who wish to help. Ekose, thank you. Gakyog tatamskat nawa.
Good morning, everyone. My name is John Macbeth, and I'm the CEO of TryCycle Data Systems. Before I get started, I would like to thank the people of Treaty 6 territory for their generosity and their support for hosting this wonderful event. I'd also like to thank Grand Chief Cameron, Chief Rain, Chief Bear, Grand Chief Ross, and Vice Chief Pratt and Vice Chief Laura for inviting us to share in this truly historic announcement. Today is the culmination of a 12-year journey for us at TryCycle. It's been an amazing journey, one that has seen us visit Indigenous communities in 5 provinces, 3 territories, 4 American states, and soon in Australia, Central America, and South America. For thousands of years, Indigenous people have been health and technology innovators by embracing the teachings of elders and previous generations, and by sustainably harnessing only what the land, water, and sky provided. Today's declaration is in keeping with the spirit of the work completed by those before us. Western medicine has a lot to learn from Indigenous people. And we, for one, are very grateful for the chance to work amongst these incredible communities so that we can all benefit from the old and the new ways. We are thrilled, small part of this ambitious vision, to reimagine the relationship between traditional healing and modern methods as we collectively embark on an exciting new partnership to improve Indigenous health outcomes. This is truly a joint venture, and TryCycle would specifically like to thank the Federation of Sovereign Indigenous Nations, Big River First Nation, IBM Panorama, Microsoft Canada, Roche Canada, Indigenous Services Canada, the Royal Canadian Legion, OSI CAN, Aboriginal Veteran Autochones, RGAX, and PharmaSmart for helping us to get this idea off the ground. Thank you very much.
Thank you. My name is Stephen Ross, Grand Chief of the Saskatchewan First Nations Veterans Association. I'd like to thank, first of all, I guess, the Creator for giving us another day, another beautiful day. Thank you. We want to thank Chief Jack Rain from the Big River First Nation and TryCycle for including the veterans in this project. We are proud to advocate for programs that are our First Nations veterans. Our members have often shared stories of being post-war Indian residential school survivors who return home with complex and mental health problems, like chronic, debilitating, and escalating trauma, stress, and endless needs for crisis intervention, support, mentoring, advocacy, retaining, re-education, and a desire for community integration, and acceptance. This accumulation need by an often ignored group of people that amounts to discrimination by public service requires a focused design approach to best identify gaps and find solutions for new policy, practice, programs, and services. This project allows our participating veterans with PTSD issues who want to reach out for help and have the assistance they need at their fingertips. We know that TryCycle increases communication, improves engagement for our veterans. This is something new and unique in providing health services to our people. But we are willing and ready to learn and take on the challenge. Thank you.
Good morning, everyone. I too would like to acknowledge our Creator today, and I would acknowledge the leadership in the room, and of course our distinguished guests. And thank you, Grand Chief, for your kind words always. Today, I just want to say that it's a really honor and a privilege to be able to say a few words in regards to the new app, an exciting tool that I understand that has been used and it's been effective in the United States. And Chief Rain, your courage and your for leading a project. I believe there's 10 other nations involved in the project, so I applaud you and your council, your health team. I understand Derek Klein in this district. He's one of the leads as well. But, you know, we know with this pandemic, you know, has shown how mental health and addictions continue to plague our people. And, you know, I live in my own nation in Ochapowace, and, you know, not being able to have those resources at our fingertips has been challenging. And of course, we still continue the struggles, the isolation, and especially with addictions. And I think this tool is really going to help to support the holistic healing, and just even the confidence that, you know, the ideas and, you know, by our people, for our people, meaningful and relevant, I think is really key in terms of putting something forward. There is a spirit and intent to our treaties, the medicine chest clause. And I thank you for taking that spirit and intent and bringing it and showing the world, our country, you know, how to take that spirit and intent. And, you know, our ancestors, you know, touched the pen, and they talked about famine and pestilence, and that was all incorporated in our treaties when they negotiated. So these days were talked about, and I'm so proud that our nations have that wisdom, that courage, and that vision to do things today to help our people, because they are suffering, and less will suffer because of what you've done. So thank you, everyone, and I'm really looking forward to hearing more about this app, and I think others are going to come along and be looking for this tool in their own communities. So thank you so much for giving me the time to applaud you all in this great new innovative project. Thank you.